Anemia and pregnancy. Yes, sir. Anemia and pregnancy can be of basically two types, that are physiological anemia or pathological anemia. Physiological anemia occurs due to hemodilution. Here, the hemoglobin never decreases less than 11 gram. Pathological anemia or anemia in pregnancy is when hemoglobin is reduces less than 11 gram. So according to WHO, anemia in pregnancy is when hemoglobin is less than 11 gram per dl. And severe anemia in pregnancy is when hemoglobin is less than 7 gram per dl. And very severe anemia in pregnancy is when hemoglobin is less than 4 gram per dl. So most common cause of anemia in pregnancy is iron deficiency anemia. Iron deficiency anemia is microcytic hypochromic anemia. Here, the MCV, that is mean corpuscular volume, will be less than 75 femtoliters and MCHC will be less than 30%. And these two are the most sensitive RBC index used. Now, serum ferritin, which is the storage form of iron, is the earliest and most sensitive marker of iron deficiency anemia and is the best investigation for iron deficiency anemia. In iron deficiency anemia, three values increase. Those are TIBC, that is total iron binding capacity, red cell distribution width, and erythropoietin levels. Screening for anemia in pregnant women is done in all pregnant women in the form of complete blood count. So any female that comes in her first antenatal visit, we do the screening test, plus it is again repeated between 24 to 28 weeks. So treatment of iron deficiency anemia can be oral, parenteral, or by blood transfusion. So oral for iron deficiency anemia is 2 iron and folic acid tablets per day. 2 iron and folic acid tablets per day. So hemoglobin here increases after 3 weeks at 0.7 gram per dl per week. So when the patient's hemoglobin reaches a target of 11 gram per dl, we put the patient back on maintenance dose of 1 tablet per day throughout pregnancy plus 180 days after delivery. So coming to the dose that we use is iron of 60 milligram elemental iron and 500 microgram of folic acid. This is according to the Anemia Mukta Bharat program. So we usually start giving normally iron preparations to all the pregnant women from 4th month of pregnancy. Here we advise 1 pill per day, so which is continued throughout the pregnancy or at least 180 days or 6 months before and after delivery. Non-pregnant female also we under the program we provide iron and folic acid. Here also 1 pill per week we give. Then coming to parenteral iron therapy, it is indicated in patients who are non-compliant, non-tolerant, and severe anemia in early 3rd trimester. So that is less than 7 gram per dl. So here also rate of increase of hemoglobin is same like that of oral therapy only. And the most common parenteral iron that we use is iron sucrose. And the best is iron carboxy maltose. 1 ml of iron sucrose provides 20 milligram of iron. So how we use parenteral iron is we take for example, we take 5 ml of sucrose. So 5 ml of sucrose will contain 100 mg of iron and we dissolve in 100 ml of normal saline. So initially we give it slowly and we give it like 20 to 30 drops per minute, and then for 30 minutes we have to give like this because patient often complains of hypersensitivity. We can give a maximum amount of 200 mg of iron sucrose in 100 ml of NS on alternate days. That is 2 times per week we can give. Now the dose of parenteral iron can be calculated by 2.4 into weight in kg into hemoglobin deficit plus 500 mg, which are the iron stores. Now the hemoglobin deficit is calculated by target hemoglobin minus actual hemoglobin. So the target hemoglobin is 11. So minus patient's hemoglobin gives us hemoglobin deficit. Now the indications for blood transfusion are hemoglobin less than 5 gram per dl in any trimester, severe anemia in late 3rd trimester, that is less than 7 gram per dl, anemia causing heart failure, refractory anemia, and acute hemorrhage causing hemoglobin less than 6 gram, or if the patient is unstable. So 1 pack cell transfusion increases the hemoglobin by 1 gram here. Coming to total amount of iron that is needed in pregnancy. In pregnancy, around 1000 mg of iron is needed. The amount needed by the fetus is 300 mg. Amount lost during delivery is 250 mg. And the daily requirement of iron in pregnancy is 4 to 6 mg per day. So in a diet, we need to take 40 to 60 mg per day, but only 10% of the dietary iron that we consume is absorbed. So according to that, Government of India had brought out Anemia Mukt Bharat program. In first trimester, around 1 to 2 mg per day of iron is needed. In second trimester, 4 to 5 mg per day iron is needed. In third trimester, 6 mg per day iron is needed.